making me sick when I could be taking something that treats my back, my neck, my depression, my focus, my sleep. All these things are treatable with just Adderall as opposed to taking all these extra things that don't really help and make me sick.
Yeah. And I hear what you're saying. Unfortunately, as a general rule, what we try to do is follow what's called evidence-based medicine.
So,
And the evidence based on populations of folks who have similar symptoms. And the symptoms that you're reporting, even if your specific experience with Adderall was a positive one, are not indications for using Adderall. And as a level 2 controlled substance, right? So that's the other issue with Adderall, is that it's a very tightly controlled substance, right? It's not a run-of-the-mill medication. It's the most controlled a medication can be and still be legal in the United States. So we have to be very judicious and very careful and cautious about how we use it and how we prescribe it, because it has such a strong addiction potential, and because it is so tightly monitored. So it's while some medications are used for what's called off-label use, so we may use some medications for multiple different things. When we're talking about level 2 controlled substances, we tend to use those only for the specific FDA-approved indications because there is such a risk associated with them, because they are not run-of-the-mill medications. So again, if you're wanting some a way to address some of what you feel are potentially ADHD-related symptoms, there are other medications outside of that category of medication
I'm tired of
that you might be able to
taking
explore.
medications that might work. I want to take as little as possible of medications that do work. I don't want to spend another 15 years trying the new antipsychotics or mood stabilizers or antidepressants when I could just be taking a small dose of this stuff and be better. It's already been proven to help. I got a job, I had an apartment, and then I got dangled in the wind, and I just want to take something that works. I don't want to take something that might work. I don't want to take something that'll take 3 months before I might feel anything. I just want to take something that works, and that's it.
I understand. At this point, after reviewing the especially the medical part of your chart, and granted, this is an abbreviated appointment, and so that makes it a little more challenging. But at this point, if you were my patient, I would not be comfortable prescribing Adderall, for many of the reasons that I just outlined.
Even though
there would be alternative things that I could offer you, but I wouldn't be comfortable prescribing it at this time. So, you can continue to have that conversation with Dr. Tejero. Maybe you can talk with your guardian and see if you can get the records from Wisconsin, and maybe that would provide additional information. And that way that might help to explain to Dr. Tejero kind of what that psychiatrist was seeing at that time, how long ago was that, what were the effects, if it was clearly documented that you had stable vital signs and everything else was going perfectly well, and you have a well documented from another psychiatrist experience with it, then that would be something that she could certainly take into her medical decision making and working with you on a treatment plan. But at this, and so I think that that's reasonable. I think it's reasonable to see if your guardian will at least make the effort. It doesn't mean that the records are definitely going to be obtainable, but I think that that's, you have a very clear memory and experience of the medication, and if that can be documented, that's useful information. Whether that will ultimately change the outcome, I don't know, but it's good information to have, so that you can be getting the most integrated and coordinated kind of care possible. And I think that's just good medicine to try and rely on, what's been documented as having been effective before. Because part of the difficulty in trying to remember our treatment experience over time, things can get things can get shifted, right? And so the advantage to previous records is that it's documented in real time, kind of what the experience was. So it may fill in blanks that you're not currently recalling from that
Yeah,
treatment.
we
episode
can
as well.
try to talk to Karen and see if we can get that done.
Alright,
And then we can
Yeah,
fax over the request for those records.
sounds good.
Yeah. So, I appreciate, I know it can be really difficult for a lot of people to have to talk to somebody that they've never met before about a lot of things that are very deeply personal, and I appreciate your willingness to be open today, and share with me what's been going on with you. I hear everything that you're saying. I believe that your experience was that the Adderall was helpful. Like, I believe that that's your experience of it.
Mm-hmm.
I just, given everything else and the risk related, even if you had a positive experience many years ago with that medication, at this point, based on the data that's available, I wouldn't be comfortable prescribing it again at this point.
Why is that?
So,
For the reasons of the heart rate, and not having a clear outline of ADHD symptoms, I believe. Is that correct, Dr. Noble?
yeah, I think that if we take as a given, and this is a big if, because I think that your experience and the provider's experience of what's going on with you could be very different. But if we take as a given that you have a psychotic spectrum illness, that you have schizophrenia, the other thing is there's very good data that medications like Adderall, stimulant medications, can amplify or worsen schizophrenia and make it harder to manage.
But we've
And so
already
that's yet
proven that
another
doesn't
reason that it
happen.
would be a potentially, a treatment that would be very fraught with potential side effects. I don't know what the status of your schizophrenia was way back in the day when you were on it before. It's possible that your symptoms are currently more pervasive or more prominent now than they were then. In which case it would make sense that it didn't give you trouble then. I don't know, because without the records, I don't know what you were treated for.
Like, it doesn't make sense to me to take something that gives me diarrhea and nausea and keeps me up all night. When I
Do you
could be-
know which medicine it is that's doing that?
It's the one that they recently upped.
So he said that at the last medication review, Dr. Noble increased the Vibrid, and he said prior to that increase he wasn't having any symptoms, but
Okay.
she added the 10 milligrams at the last appointment because of the increased depression. But he's saying that since he started taking that extra 10 milligrams, he's been having nightly diarrhea and vomiting.
Okay. Well, that's certainly, I don't blame you for not wanting to take something that's making you feel sick to your stomach. I don't blame you one bit. The Vibrid's supposed to be taken with a meal. I don't know if you're normally taking it with a meal or not.
Do you?
But in any case, I think that is worth, making sure that Dr. Harrow is aware of that before the next appointment.
We
Well,
can do
she
a
already
consult.
knew.
We
Feel
can
comfortable
do
with
a,
it, that you guys can talk about a med consult.
we can do a consult today and let her know that. And actually, I'll speak with the AFC staff too, just to get their input to see how sick he actually gets at night and how often they've recognized it and noted it.
But I separate from the issue about the Adderall, I don't blame you for not wanting to take a medicine that makes you feel physically ill. That's completely understandable, and certainly to the degree possible, if that's the newest medication and you aren't noticing a benefit and you are having significant side effects from it, it certainly is something that you should bring to your doctor's attention.
Yes, that's why I'd rather just take the stuff that works than keep on testing things that take a month to kick in and they never do.
Yeah,
I
I
mean,
understand.
Hub
I
Dog,
understand.
G-Done,
And if
Prozac.
the risks were all zero, then I think that would be a much easier thing to contemplate. But the risks are not zero. The treatment that you have the experience of working, that treatment is a very high risk treatment currently based on your physiology.
Well,
And so
with
at
my
this
back
point, it would
being
be something I would
broken,
recommend. But
not
it's a conversation
treating it
that
is
you can
probably what's
continue
causing
to,
the
like I said, you can
heart
try and
rate.
get the records and continue to have that conversation.
And we can do the consult today. When I drop you off, I can sit there and I can do it. I can show you on my tablet.
All right.
I'll show you what I typed to her, so that way you'll know what we send.
Okay. thank you again so much for your honesty and for making it in today. I know it was kind of a last minute switch. The Zoom has been an intermittent interruption today, so having you come in person was helpful. If Alice, if there's anything else you want to add, if you want to go ahead and open the door and then
Yeah.
they can come and we can get the checkout started.
I'm just glad we were able to get him in on time, or
Yeah, I
at least
appreciate
by the
that.
time
I
we
appreciate
did.
that.
Yeah.
Anything for Brad?
No, this was just the second opinion, so there's no changes in his meds today, and he should keep his next appointment as scheduled with Dr. Tahiro. They are gonna do a consult because he is having some side effects if he wanted to have it first.
Okay.
Thank you.
Okay, great,
Thank
thank you.
So much.
Have a
Take
good
care
day,
of yourself,
Dr.
Bradford.
Noble.
Thank you for coming.